I want to bring us back to talking about information technology for its original purpose. The purpose of this stuff is, of course, not just technology, how much of it can we get out. It's about delivering better care, higher quality care, care that is more effective, safer, more efficient. What's the evidence that information technology has any role to play in that at all? Do we have any evidence that IT or ICTs work? Or is this purely faith-based?
No, it's not faith-based. We do have evidence, and really an exploding evidence base in a lot of ways. I think when some of these systems were first developed and in place, it was in some of the leading healthcare delivery institutions, in the U.S. and in other developed countries. And so, at the beginning, when we had to rely on evidence from those settings, I think what we saw is that it really could make a big difference, and in particular areas. So in medication safety, I'd say that's where the evidence suggests that electronic health records, coupled with some of the other areas that we talked about before, clinical decision support, that they can really make both prescribing safe medications and catching errors and sort of other potential other errors that could result in adverse drug events.
Okay. So it seems to me like what we should recommend is, look, let's just implement these things broadly, and then we're going to get big gains in safety and effectiveness. Is that right? Because some of the evidence says that when we've gone from these leading institutions to broader deployment, the payoff doesn't seem to be there.
Yeah. So that's true, and I think it's because we can't forget that this is a tool, and you give people a tool, and a tool will be used in different ways. And so, can a hammer be used to build a house? Yes. But can hammers be used in a lot of different ways? Yes. And so what we don't really yet understand is how to ensure that every time you use these tools, you get the same outcomes.
Got it.
So the potential is there, and that's why everyone is so excited about these tools, because you can see that if we could replicate those results across the country, the impact would be huge. But we're also realizing that doing that making sure these tools are used in a consistent way, across all of the healthcare system is very hard, and we don't yet know how to do that.
So really good evidence that from a medication safety point of view, something we have talked about in this class, huge problem, that again, electronic systems have a very important role to play. What about things like adherence to basic guidelines, prevention? Do we have evidence on those things?
Yep, so that's probably the second area where I'd say the evidence is the most solid. And it's for, in some ways, a similar reason, which is that it's clinical decision support can help make sure that the doctors remember to do these key evidence-based practices. And so those are the two areas where I think the evidence is the most solid. When we start to get out into other dimensions of safety and efficiency and quality, I think the evidence becomes a little bit more mixed. And there are studies you can point to where it seems like electronic health records had a big impact, and some where it had no impact, and some cases where it even seems like it might have made care worse.
Why hasn't the deployment of technology had a big effect on improving the quality and safety and efficiency of healthcare?
Yeah, so I think we're still trying to figure out what the answer is to that question, and I think that there are probably a couple parts to it. I mean, I think one is that there's a whole bunch of context that matters, and really understanding what's happening in a given care delivery setting, and sort of what's going on with the types of physicians and nurses that are practicing there. I think we forget that human behavior is sort of a huge part of this, and adopting a new technology has to come with the human behavior change. And so you can say there's an electronic health record that's in this hospital, but is it being used by the clinicians in that setting, in the same way that it was in the study that was done to assess the impact, right? That's where there's just a huge opportunity for variation.
Got it.
And I think the sense is that there are some places where the human behavior piece didn't change in the way that was needed to use these tools consistently. And I think to give a really concrete example, we keep talking about clinical decision support as a really important piece of what makes these types of technologies so valuable. There are places where clinical decision support is turned off. There are places where clinical decision support is ignored, right? I mean, that's where these human behavior pieces, can come in. And if
So let's get granular on that for a second. So a clinical decision support tool might be something like you're prescribing one medication and it alerts you that that medication interacts with a different medication. Or it could be a reminder that, hey, you have a woman, she is due for cervical cancer screening, for instance. So reminders, prevention, safety issues. There are places that turn these things off. Why would they do that?
Yeah. So you can imagine that if you are a physician who is treating a patient in the context of potentially a short visit, we know that most primary care visits in this country are about 15 minutes, right? You're going to have a set of priorities, and it may be that you don't have time to get to everything that you need to. And if you have a computer screen that keeps flashing up and telling you to do something that you've made a conscious decision doesn't make sense for this patient, right? That's going to get very annoying.
Yes.
And you're probably going to turn it off. These systems aren't sensitive enough yet to really be customized to the particular physician or the particular patient. And so part of it's a technology problem. We have to get better at that. But part of it is always going to be a human behavior problem, which is that the person that's getting alerted has to be, open to those.
So what I hear is technology is a tool, but like any tool, it's about how it's used, and that there is a complex set of interactions between human beings who use these tools and the tools themselves. And we just don't understand that very well. But the funny part is, we're not the first ones to have gotten here, right? Healthcare is actually sort of late in the game. There are lots of other industries that have been thinking about information technology, communication technology, and how that affects productivity, quality, cost. Does anybody else have anything to teach us on this, or is this something that healthcare is going to have to figure out completely on its own?
So I think that there's a huge amount to learn from the experience in other industries. And as you said, they really went through this information technology revolution, a couple decades ago. So we've had some time to study and understand the experience. And I think the evidence is really clear that it takes about a decade to figure out how to use information technology well. And so the question is, what takes a decade, right? It seems like a really long time.
It's a long time.
And I think the key insight from this is that, organizations have to go through an evolution of first using these tools, but then realizing how do they need to change what they do, how they operate to take advantage of the new capabilities that IT provides.
Got it.
And so just to give a really concrete example of this, right? So what does IT make available? It gives you structured electronic data that you can look at and for the first time sort of have quantitative measures of how your organization is performing, right? But if you've never had that data before, it's likely that you're not set up to look at it, understand how to operate differently because of it, right? So it's a process of saying, okay, we have this data available. What do we do with it? And how do we design and redesign our organization to make use of it? And that process, takes years.
How does this new technology change your interactions with other providers, and what can it do, and where are the challenges?
Sure. So I think, in some ways, data is the universal language, and we haven't, we're going to need doctors and people who work with doctors who speak the language of data, who can understand how to look at data that's in an electronic health record system and make sense of it and understand what they're seeing. So part of it is just a complementary set of skills. We need people who are going to be comfortable with data. But I think a second piece of it is it's an opportunity to step back and revisit roles and responsibilities. When you have access to data that multiple people can look at the same time, it allows you to work in different ways, and particularly with the team, right? So when you treat patients, it's not just you. You oftentimes might have a medical assistant or a nurse. And so this technology really would allow you to to sort of have a shared pool of information that you're all looking at, and potentially allow your nurse to do things that they never could do before, in terms of managing the patient, understanding what some of the key issues are, and potentially either dealing with them before you would see the patient, or teeing them up so that your visit with the patient could be that much more efficient. So there's sort of a wide range of ways in which you could think about how an electronic health record change the way that you deliver care. And it's a question about sort of being thoughtful about which changes should be made, and then actually working to implement them.